Hey everyone, Dr. Tim Reynolds here with Urgent Care Management Monthly, July 2011. And I'm here with my great friend, colleague, business partner, and my soulmate, Miss Kim West. Hi Kim.
Hello, Dr. Reynolds.
How are you?
I'm fine. How are you?
You want to tell everyone what you do for Healthcare Express?
I'm in charge of the occupational medicine for your drug testing program. I oversee about 500 companies, randoms, drug screens, physicals.
Yeah, and it's awesome, right?
Yes.
It's good business.
Very good.
And so a lot of people out there are either just starting urgent cares, they've never done this before, or they don't have this kind of service they offer, or they're having questions about it. So what I'm hoping we can do is just kind of give them some answers if they were interested in doing that, and they may not be, but if they were, they'd have some answers for that. So let's talk about a little bit about why do you think they should consider offering drug testing?
I think it's a big deal to offer drug screening in your company because it lets you know what type of employee you're getting. It's a benefit for you, it's a benefit for the other employees that you have working for you, as for their safety.
Yeah, and as far as a business, is it a good idea for urgent cares to kind of get in that business, or would you
The
avoid
revenue is excellent.
The revenue is excellent,
yes.
yeah. And one of the things I really do like about it is you can create a separate revenue stream within your urgent care that doesn't involve the doctors.
Yes.
I mean, they have to oversee it, they have to be available if you need them, but in general, it runs without that. So the cost stays a little bit lower for that purpose. And how many companies do we have now that we do?
About 500 companies that we do business with.
That's a lot of companies. And we don't do all of them every day, and some of them will skip a while, but in general, we keep them going. All right. Talk a little bit about DATIA, because we talk about DATIA credentialing. A lot of people out there may not even know what DATIA is, so explain what that is.
DATIA is a company that we go through like for training, through testing, for information, all types of things. They have like gain market sharing. Most companies that you have won't let you do their drug testing if you're not affiliated with some type of DATIA organization or some other organization. I don't know the other ones because I've never dealt with them. And then the market value.
So it's like a national certification.
Yes, a national certification.
They teach you how to do it and how to obey all the rules and those kinds of things. Okay, so, and a lot of companies require us to do that.
Yes, sir.
Okay, what else do they do for us?
The market advantage, it helps you to compete with the competitors and the non-competitors. Basically, it lets your competitors know that you're out there.
Right.
It gives them something to say, oh, I got to do something better to make myself look better.
Right.
So basically, that's what the marketing advantages is for the drug testing. Right. Improving employees' professionalism, it helps them keep and know the standard rules and guidelines.
Our employees you're talking about now,
yes.
that they have to meet certain certifications, because we went to court on more than one occasion where somebody does a drug screen and the person disagrees with the results, or it turns out, if people don't know this, people do try and fake their drug screens, right? Talk a little bit about what some of the parameters we put in place to keep people from faking their drug screens.
We have no sinks in the bathrooms, and we also keep blowing in the commode, because you have people that will come in and get water out of the commode and try to give it to you as a sample, and you know it's not a sample.
Right.
So we keep blowing in the commodes. There's no sinks. They only have 3 minutes in the restroom because we have to read the temperature on the cup.
Some of the exams have to be observed.
Yes.
Right. That's required by the different companies or something like that. Okay, good. So and DATIA, what that does is help us look like we are more legitimate and following rules. So if we do end up in court, we can say we follow the DATIA certification guidelines along.
And that's what the DATIA, working with the legislation, it helps you if you ever have to go to court. You have doctors and staff members that can go with you to back you up on what type of test you've done and what you've done and why you've done that.
Good. So if I am a new urgent care owner and I just want to start this program and I've never done any of this before, and I say, yeah, I think that's a good idea, what would I do to get DATIA certified?
You would go to www.datia.org. Talk to some of the ladies there. They will get you set up as a company, get your clinic facility certified to become a accredited lab testing site to be able to do drug screens. Okay.
Now we also have, and this isn't our talking points, but we also have an on-call person. Kind of explain how that works.
Monday through Friday, I have a person that starts call at 5 o'clock. They're on call from 5 o'clock until 8 o'clock the next morning. If a company calls them out to do a post-accident drug screen, which is most of the time what it is, a post-accident, they go on site or come to the clinic or go wherever that company wants them to go, and we perform a drug screen.
Right. Now, I understand what you just said, but for people who've never done it, what is a post-accident drug screen?
It's when an employee get injured on the job.
Yeah. They only have a certain time frame with which to do that drug screen, and if they don't do it, they miss the window and then they can't say anything, right?
That's true.
So that's why we have someone on call. So somebody gets injured at 1 o'clock in the morning, how long do they have before they can
3 hours.
So they got 3 hours. So it's very important to the companies, at least, that they get that done within that time frame, because if the person's on drugs, it decreases their liability
Yes.
as well.
And especially if they, for some reason, are having an alcohol test, because it can alter the results.
So we do the drug and the alcohol
Yes, sir.
testing at the same time. Okay. And then DATIA also has this book, right? The
Mhm,
red
the red
book. Explain that a little bit.
The Red Book has all the rules, regulations that you need to follow as to be a certified collecting facility.
Okay.
It has all the guidelines from breath alcohol testing, what guidelines you need to follow for that, and also on the drug testing side.
So if I was just starting my urgent care today, to see if you agree with me, if I was just starting my urgent care or just starting this service today, I think the first thing I do, if I'm the doc or I'm the owner, the first thing I'm going to do is hire the one person I need.
Mm-hmm.
Whoever that person that's the champion of that. Get them DATIA certified,
Mm-hmm.
have them help me set up the program, and then as the program grows, then you can hire other people to do more things. Is that kind of how you would approach it if you're going to do it? Okay. And we just started a new location, and that's kind of what we're doing down there right now. Yeah. Okay. Good. Anything else?
That's it.
Yeah.
That's all the world.
Yeah, and I think it's a really good business because for two reasons. Obviously, it's a good income stream, but I think more importantly, if you're offering occupational medicine services, it goes along with the whole package. With your physicals, your workman's comp, drug screens, companies like it when you can offer them.
Because most workers' comp companies want a drug screen as well in order to make sure that person wasn't high or drunk.
How would you? So let's go back to one other question. If you're out there starting, how would you market it? Just start going to the companies and saying.
I would get a phone book and go through the phone book and get companies that I know. I get the big companies like the Cooper Tires and the paper mills and stuff like that, and start just going through the phone book and then start going out in the world marketing.
And just saying, hey, we're now offering this service, we have it available to you. Find out who your competitors are who are already doing it, because somebody in your market's probably doing it, what they're charging, and then figure out how to get it compete. All right?
All right.
Thank you very much.
Thank you.
Appreciate it.
Appreciate it.
Bye.